So here is my 360 of my room. Here is my patient. He will be videotaping. Okay. So here is my ID badge and then my consent form. Jesse, do you consent to being in my video today?
Yep.
All right, so I would start off by making sure I washed my hands, which I've done already. And then I'm going to introduce myself. So I'm Candy. I'm going to be your nursing student today. I'm going to be performing a head-to-toe assessment on you. Can I have your name and your date of birth?
Jesse Mitchell, 6/21/99.
All right, so then I would confirm that information he just gave me with his wristband, which it did match up. And then I would make sure I provide privacy for the patient and go over his medical order. So then I would ask if he has any health issues that I need to know about. Do you have any health issues?
I just had knee surgery 2 weeks ago.
Okay, so he did just have knee surgery. Do you have a history of diverticulitis?
Nope.
What about COPD?
Nope.
Nope. All right, so the patient, other than his knee surgery 2 weeks ago, he does not have any health issues that I should know about at this time that would affect my assessment. So now I would go into my mental health assessment. So the patient does seem to be awake. And then can you answer a few questions for me? What is your name?
Jesse Mitchell.
Where are you today?
Home.
And what time is it?
About 6 p.m.
Okay. And then where are we? Or what are we doing?
Head-to-toe assessment.
All right. So the patient is alert and oriented ×4. I'm just applying my gloves because I will be touching him today in my assessment. I'm a little bit sticky because my hands are sweaty. And then I am going to finish assessing the rest of his appearance. He does seem to be content. How are you feeling today?
Good.
Okay, so his behavior does affect his mood. Nothing seems to be wrong with him. He hasn't expressed anything that I need to know. His appearance is put together. He is dressed for the occasion. His clothes are not dirty. There are no holes or anything. So now I will move on to assessing his facial features. So his eyes are both symmetrical. His nose is midline. And then if I were to draw an imaginary line, his eyes would match up with the top of his ears. And then can you smile for me, frown, puff your cheeks, and raise your eyebrows. So all of his facial features were also symmetrical with movement. So now I'm going to go in and do his eye assessment. So can you go ahead and pull your eyelids down for me? Okay, and then go ahead and move your eyes around. So his sclera of his eyes is completely white. I did see minimal red veining, but that isn't out of the ordinary. That's what we like to see. So now I'm going to assess pleura on you. So I'm going to do the positions test first, and I am going to assess the 3 cranial nerves. I'm going to assess cranial nerve 3, which is oculomotor, cranial 4, which is trochlear, and 6, which is abducens. So I'm going to have you follow the tip of my pen light here with just your eyes. And as I am doing this, I am looking for any shakiness in his eyes, which would present as nystagmus. But I did not see any. His eye movements were smooth and clear, so no nystagmus was present. So now I'm going to do Perla. I'm going to make sure his pupils are equal. So the pupil seems to be about a 7 on this side, and then on this side as well as 7. They are both round. So now I'm gonna test light, and I'm gonna go ahead and shine it directly into this eye and see if it constricts, which it did, and then I'll do the same on this side, which it did constrict. Now I will shine the light in his eye on this side and check to make sure it restricts on the opposite side. So his eye did constrict. Now I'll do the opposite. And they did constrict. So his pupils are both reactive to light, both kinds of light. So now I want you to look at the tip of my pen light, and I'm just testing for accommodation to make sure his pupils both constrict and converge. I'm going to start far enough out so the patient has time for his eyes to converge. Go ahead and follow the tip. All right, so both of the pupils constricted and converged. Now I'm going to move on to his mouth assessment. So I'm going to check his lips, which they are a pale pink color. The rest of his face is, pale beige, no discoloration. I don't see any lesions on the face. No specific signs of drainage or anything, no discoloration. It looks good. So now I've assessed the lips. Now I'm going to go ahead and assess the inside of the mouth. You can go ahead and open your mouth for me. All right. I don't see any lesions on the cheeks. His teeth are white and they are all intact. Do you still have your tonsils?
Yep.
Okay, and then no dentures, correct?
No.
Okay. So his teeth are all intact, and I'm going to go ahead and look at his tonsils. His tonsils are a grade 1. There's no inflammation, no extreme redness. So those would be a grade 1. And then I'm going to look at your tongue. Go ahead and stick your tongue out for me. His tongue is moist, no signs of cracking, it's pink, no lesions, no drainage. So now I am going to move on to his neck assessment. I'm just going to go ahead and, before I move on to that, I'm actually going to check his hair. So I'm going to make sure that there is no signs of balding, patchiness. So I'm going to make sure it's all equally and evenly distributed, which it is. It's dry, not oily or anything, no lesions on the scalp. So now I'm going to go ahead and move on to his neck. First, I'm going to just visualize, see if I see any lumps, which I don't. There are a few primary lesions in the form of freckles, but they are flat. So now I'm going to go ahead and feel. And his trachea is midline. And I do not feel any masses on his neck. Masses are lumps. So that is good. So now I am going to move on to his posterior, I'm going to do a general observation on him. So he is sitting up. He is not using any accessory muscles to breathe, which would be the trapezius or the trapezius or the sternocleidomastoid. It's not using either of those to help breathe, just using his diaphragm. So now I will have him turn around and I will check a few things out. Go ahead and turn around.
Like with my legs facing that way.
Yep. All right, so I'm just going to check his spine. Make sure his spine is straight. It is midline. There is no curvatures in it. And I'm going to check his breaths. So can you go ahead and take a deep breath for me? All right, so his breath was smooth. My hands floated out and floated back in. There was no tightness or any kind of problems with that. So now I will go ahead and listen to his breaths. So each time I put my stethoscope on your chest, can you take a deep breath for me? All right. And I'm going to make sure that I avoid any kind of bone structures when I do this. Alright, so his breaths were clear. I didn't hear any wheezing or crackling. So that is what we like to hear. Now you can go ahead and turn back around. And I'm just going to do the same thing on the front. So each time I put my stethoscope on, please take a deep breath for me. I'm going to start above the clavicle. Alright, so again, I did not notice any kind of wheezing or crackling. His breaths were all smooth and very good. So now I'm going to have you go ahead and lay down on your back. I'm going to assess your abdomen.
Head right here.
Yep, go ahead and put your head right there. And then I'm going to put the drapes over him. All right, so first I'm just gonna visualize all 4 quadrants. The skin coloration is all the same. I do see a secondary lesion here in the form of a tattoo, but there is no signs of drainage or infection on that. The 4 quadrants are all symmetrical. The contour of his stomach is flat, and I don't see any pulsations with that. The umbilicus is midline and symmetrical. It is inverted, and I do not see any signs of drainage or redness with that. So now, are you having any pain in your stomach?
No.
Nope. All right, so now I'm just gonna auscultate. I'm gonna listen for bowel movements in his, in the 4 quadrants, and I'm gonna start in the right lower. I also noticed another secondary lesion in the form of a scar from an appendicitis procedure. All right, so I did hear about 10 to 12 vowel sounds within the while auscultating, which is in the range, so his vowel sounds are active. So now I'm just gonna palpate, and he said he didn't have any pain in his abdomen, so I'm gonna go ahead and start in the right lower quadrant. If he did have pain, I would start in the specific quadrant to be able to end in the quadrant that his pain is present. So just let me know if you have any pain or tenderness when I am touching you. Any pain?
No.
Okay, so the patient did not, he didn't guard at all while I was palpating, didn't report any pain. His stomach was soft, it wasn't rigid, and I didn't notice any distension. So now you can go ahead and sit back up. And do you have, go ahead and turn around for me, sorry. And then do you have any past history of kidney problems?
No.
Nope. All right, so I'm going to do the percussion test, kidney percussion test. Let me know if you have any pain with this. Any pain?
No.
No pain. Any pain?
No.
Nope. So he did not report any pain with that. So now we are finished. So I would do my closing. I would position my patient for comfort, make sure the call lights are in reach, make sure the bed is in the lowest position, side rails up ×2, and then I would go report and assess any of the findings I found during this.